Good evening, all. I'm delighted to introduce our speaker for today, Dr. Swetha B Ram, who did her MBBS from Government Medical College, Calicut 2006 batch and DCH at Government Medical College, Calicut. She joined Government Health Service in 2018 and now working as a pediatrician and assistant surgeon in FHC Valapattanam. She's a brilliant orator, voracious reader and writer, and she has authored 4 books. She has a keen interest on public awareness in child and adolescent health, and she's also my best friend, my batchmate, and my bloodmate. Today, we have an interesting topic for discussion: substance abuse in the adolescents, which is very relevant in this era of increasing incidence among children and adolescents. Let us welcome Dr. Swetha to enlighten us on this topic.
Good evening. Thank you, Dr. Swetha, for those lovely words. This is indeed a special moment for us. Respected office bearers of Kannur IMA, distinguished senior doctors of IMA Kannur, I am indeed blessed to be talking in front of you on this topic. At the onset, let me thank Rajmohan sir for giving me this opportunity. I have only very few slides. I intend to say a little bit of what's happening around. Of course, you people know better than me, but still I would like to share a few things which have been shared with me from the excise department, because we government doctors, we work closely in relation with the police as well as the teachers and the LSGD. So I would like to share a few anecdotes, and let's go in a very interactive way rather than let's go in a kind of discussion rather than in a class or a topic presentation. Okay, with this, I'll just go to the preview, what I would be talking about today, mainly the significance of the issue. And also why adolescents, the susceptibility of adolescents, the different forms of substance abuse. We know each day different forms are coming up, the effects of commonly abused substances, how to identify at-risk adolescents. Even if we don't identify what kind of drug they are abusing, at least if we can identify whether they are at risk for abuse. Even they may not have started using drugs, but still, if we can identify the at-risk adolescents and make them aware of things, maybe we can save lives. And also protective factors against substance abuse, and definitely the way out. So why this topic? We know it is one of the most challenging and costliest public health problems facing all societies and cultures. It is unanimously everywhere around the world. We know substance abuse is an issue, whether it has been legalized or whether it is still in places where it is more rampant, places where people can afford it or not. It is definitely not being an issue here. The main issue is everywhere, all cultures, all race, all strata of the society, whether you have money or you don't have money, whatever be your educational qualification, our children are being, this drug abuse or substance abuse is being insinuated into the strata of the society. There is an unprecedented increase in number since the pandemic. After the pandemic, we know from 2016 to 2022, when we take, there is a 300%, that is threefold increase in the number of cases. 26,629 cases registered under the Narcotics Act. Now we know how many crimes happen and how many crimes get registered, right? So with this, we know that the registered number of cases are only a tip of the iceberg. Even then, there are 26,629 cases in 2022, which means 3 cases every hour, which means by the time this presentation and our meeting is over, 3 new adolescents are being hooked up for substance abuse, and many more will be there left unseen. So there is post-pandemic, there's an increase in the teenagers, especially the girls. Girls are now being more commonly using these things, and girls are being caught as, the traders and agents. Girls are being targeted because it's quite easy to, for girls, it is more easy to traffic these things because, girls don't get stripped off usually. We can search boys, but we cannot search girls as such. So they are making use, adolescent girls are making use of such, such flaws in our system, and they are being lured into this drug substance abuse. Now, risk of dependence is more in adolescents because it is said that the age where you start using substances, that is the main factor determining whether you go on to become an addict or not. So the earlier you start using substances, there is higher chance that you become addict, whether it be smoking or whether it be alcohol. The earlier you start, the more, because you develop a tolerance, you develop tachyphylaxis like that, and there is more chance of becoming an addict. And also we know, I needn't explain how substance abuse is related to violence or even cyber crimes, abuse, HIV infections, and STDs. So why adolescence? Now, adolescence is a period, for our definition, adolescence is a period from 10 years to 19 years. So why is this age group of children susceptible? Answer is simple. They are not children. They have gone out of our hands, but they are not matured enough to be adults. An age where they perceive that they have become big, because at times we say that, veldai. So they know, veldai, they have become big, but they are not mature enough to know, take responsibility for their independence. So, and also it's a period of stress. We know all the academic paraphernalia are 10th, 12th, board, like our entrance exams, everything. We know that it is a period of stress, and it is a period, it's a life-changing period. So in children who already have problems, like problems in the sense children with conduct disorders, children with ADHD, all underlying disorders, and also children who feel insecure during their childhood, maybe due to familial discord or maybe due to other things. These children are more likely to become addicts. Others may experiment. Other children also may experiment, but these kids are more likely to become addicts of substances. Peer pressure, of course, we know there is peer pressure is a very important factor, because whatever friends say, they'll do, because otherwise when they say be a man, or the show, this is school, this is the in thing, and you got to try this, and then naturally they try it. The intelligence is not fully developed, brain is not fully mature. Then there are social models and media influence. Like, all things said and done, we know that there is a heroification of all the substance abuse in the media. And whenever such things happen, if it is okay for them to have this, then why not me? It's a two-way thing. That is, media is a reflection of society. Society automatically becomes a follower of media. And of course, parents as models, because whenever, in at home, what we see, father smokes, my grandfather smokes, why can't I? So that is again a risk factor, or that is again, it comes more. So I'll just go through a case scenario. That is, this happened, I've just changed the name. A child, like, let's call her Meenu today. So this child, she was a very brilliant child, coming from a low socioeconomic family. Her family consists of only her grandmother, her mother, and her, because her father, her mother is a single parent, and she used to study well. She got all A plus until 10th standard. She wanted to become a CA, so she joined the commerce stream. So now, what happened was, in the commerce stream, all the children consider her as a somewhat nerd, somebody who should be in science stream according to our standard, in the sense, according to their standards. Why is she here? She is that, that bougie kind. She won't mingle with us like that. Nobody talked to her. So for 1 month and all, going to the new school for 1 month and all, she used to complain this like, "Amma, nobody's talking to me." But again, mother being a daily wager, she had more pressing matters. Like even from her own words, it was like, "Ivide ചോറിന് തന്നെ ഇതില്ലാണ്ടിരിക്കുമ്പോ മിണ്ടിയിട്ടില്ല എന്നൊക്കെ പറഞ്ഞാൽ നമ്മൾ ശ്രദ്ധിക്കും." That was a story. But what happened was she became more and more aloof. And later on, she stopped communicating about any bad things. She became more and more aloof. A few months into this girl was caught with drug. This girl was caught with a substance, and that substance was hidden in her sanitary pad, like the sanitary pad pack which she used from her school bag. This she got from her school bag. They used to, they used to take it from like bathroom. They used to trade this. So such is the story that is happening. The story, like, like Malala Yousafzai said, the story becomes important because it is not rare. It is not unique. There are many, many stories like this happening with our adolescents. So let's see the stages of substance abuse. Just like in anyone, in adolescence also, the same stage of substance abuse works. That is, first, there is a stage of experimentation or even prescription. Like sometimes, for ADHD and all, drugs are prescribed, or stimulants are prescribed, which are later on misused. Then what happens is there is a regular or continued use, tolerance develop, later on leading to dependence and then addiction. So in a stage of first use, everyone knows just once, you got to try everything once. This is not a very rare thing. No, we might have heard the same thing coming from our own friends when we were also in college, or ജീവിതത്തിൽ ഒരിക്കൽ എല്ലാം ഒന്ന് നോക്കണം. That is the kind of attitude that is becoming rampant among these adolescents. So once that happens, next what happens is occasional, like whenever they are whenever they are with friends. And mind you, these things are more available and less costly than alcohol or even cigarette packets. Like I'm talking about the substances like drugs. They are more easily available. They are, even 10 rupees packets are available. That much cheap it is. So and it is easily available also to those who want it. So what happens is such things again, experimentation leads to regular use, like all these occasional occasions whenever the kind of whenever they have these weekends or whenever there is a day off, means such occasions happen, then they have this. Then naturally, other than for the high they do this. Then other than for the high, to maintain this high, they have to again take that. That is the stage of regular use. It is not there. After that comes the then comes the tolerance. The dose goes up, and then comes the tolerance. Even for cigarettes, one cigarette leads to another, like that. Like you got to smoke twice. You got to smoke every during an interval breaks. You got to smoke during the lunch breaks. Like that, it happens, and then there is a level of addiction. So let us see the commonly abused substances. Tobacco, our usual BD cigarette. Other than that, there is this e-cigarettes, that is electronic nicotine devices. E-cigarettes are there, hookah bars are there. Hookah bars means are vapors, the nicotine vapors are the tobacco vapors which are flavored, which are scented. These things are getting available for our kids. And even certain things of which the content is also even not known. We really don't know whether they are, like, how much percentage of nicotine is there in it, whether they are addictive or not, but kids are getting such things. Like our adolescents are getting such things. Then of course there is alcohol, then cannabis. Cannabis continues to be the most commonly abused drug. 80% of the teenagers who are using drugs, they misuse cannabis. Then the inhalants. Now, inhalants is something which we often overlook, because inhalants like are thinners, paints, gums, glues, such things are easily available. And also the children easily available at home. So the children, they start with this. Sometimes, and this is sometimes overlooked because kerosene, petrol, such things. it is sometimes overlooked. Not that kerosene is a substance of abuse. What I meant is, if there is a tendency for an adolescent to inhale things, then we have to know that the child, that adolescent is at risk for further, like he may or may not go for substance abuse, but the child, that in adolescent is at risk if he continues, or if you see him or her continuously or even very frequently sniffing things. Then we know the opium derivatives, the heroin and the synthetic variants, sedatives like diazepam. Diazepam is very commonly misused, though not among us, morely in the Western population, but still it is misused. Then the hallucinogens, are star, MDMA, LSD, ecstasy, means MDMA or ecstasy. And then there is cocaine. Okay, thank you, thank you. Hit. So risk of tobacco and alcohol. I won't go in more into these details. We all know, as doctors, everyone knows like what alcohol does to our body, what tobacco does to our body. I'm just gonna slip those slides. There is something where know the consequences. That's all. That is the only thing which I would like to stress. Like everyone, if we know the consequences, then especially for the adolescents, if they know the consequences, we have to make them understand the consequences. Now, this is the effect of So let us take cannabis. Let us start with cannabis because again, after cigarette and there is tobacco and alcohol, the next thing is commonly abused drug is cannabis. Now, cannabis or marijuana, hashish, ganja, whatever name you call it, it is again freely, means it is becoming available, and the effect is it has, we know the effect on the body. Mainly cannabis affects the brain. Mainly cannabis affects the brain as well as the heart. The active product is THC, tetrahydrocannabinol. It causes it causes decreased that is decreased response time. Mainly that is the main effect. It depresses our thinking power. Initially use of cannabis initially causes an increase in the mood, that is an elevation of mood, a feeling of euphoria is there, but after that what happens is there is a decreases the reaction time. This is why most of the accidents happen. After this, there is a decrease in the reaction time, and also there is a decrease in the that is per time perception. There is a decrease in the time perception, decrease in bodily perceptions, and also then starts hallucinations. Okay. In eyes, what are the symptoms? There can be reddening, decreased intraocular pressure. Then mouth, there is dryness. Then skin, there is a sensation of heat or cold. There is a change in the sensation that causes tachycardia. Muscles, it, relaxes the muscles. There is muscle relaxation. Relaxation. So overdose leads to what? Overdose leads to paralysis. So that is about marijuana or cannabis. Now, next is the opium derivatives. Opium derivatives, we know it causes CNS depression as well as respiratory depression, arrhythmia, as well as withdrawal symptoms. Now, before that, cannabis has specifically three specific symptoms. That is, one is it has emotivational syndrome. It causes emotivational syndrome. Emotivational syndrome means lack of motivation. Whatever the child used to find, the adolescent used to find, used to find interesting, there is a lack of interest in doing such activities. And then there is our cannabinoid hyperemesis syndrome. That is severe abdominal pain and vomiting after use of cannabinoid. This is seen in chronic users. So incidentally, patients feel better after taking a hot bath. And this can be treated with antiemetics, as well as stopping marijuana will definitely revert the symptoms. It can be treated with severe symptomatic cases can be treated with antiemetics. Then another thing is definitely withdrawal symptoms. That is, in chronic users, 24 to 48 hours after stopping, there can be withdrawal symptoms leading to severe tachycardia, hallucinations, psychosis-like features, severe anxiety. Okay, So now coming to opium derivatives, again, we know CNS depression. Opium, the classic thing is respiratory depression. Now, the symptoms of drug abuse usually can be divided into two. One is acute toxicity, and other is chronic use, whatever happens. Okay, in chronic users. So, in acute toxicity, opium derivatives cause CNS depression. Chronic users can have arrhythmia, cardiovascular symptoms, and in case of withdrawal, there is a severe withdrawal symptom. And stimulants, the problem with the stimulants is that there is something called diversion. Diversion means our kids are being prescribed ADHD, prescribed stimulants for ADHDs, amphetamines, methamphetamines, and all for, I'm sorry, dextroamphetamines for ADHDs. And these children, when they go to college and all, what happens is others will approach them for the medication, because these people can have prescriptions. So they want to trade this prescription for money. So they act as kind of agents, because it's a prescribed drug, and these they go on to sell these things. This is called as diversion. So this is again becoming common. Okay, the effects of stimulants again, mainly cardiovascular, CNS, as well as gastrointestinal effects, and of course muscle. Now the hallucinogens mainly are LSD, MDMA, also known as ecstasy. Increased availability is there, increased sensory perceptions leading to sensory distortion. And people are definitely, in the sense, these kids are definitely after sensory distortions. Like in the exact words of one child, മഴവില്ലിന് നിങ്ങളൊക്കെ 7 നിറല്ലേ കാണുക, ഞങ്ങൾ 1,000 നിറം കാണും. That is the kind, you see smells, you feel, you feel all the sensory distortions are there. Such things are, such things are making the kids more and more attracted to these things. And this is where we have to act to break this chain. That is why breaking this chain is becoming more and more difficult. Inhalants, again, I've already told you the effect of inhalants. Inhalants affect almost all parts of the body. And in inhalant abuse, the main characteristic feature is that there can be contact dermatitis, and as well as contact issues like there can be rhinitis can occur, and also nasal erosions can occur. So whenever you see a child with a chronic nasal erosion, and even under the nails, there can be paint or nail erosions can occur. Such things are the characteristic of inhalant abuse. So how to identify the at-risk children? What are the red flag signs? We have to understand the red flag signs so that we can identify the children with risk factors. Mind you, these children may or may not be using, or may not even be may not be abusing or even using such things. But still, we have to understand that these children, there are risk factors in these children. That is, kids, when they lose interest in their family activities, when there is a disregard for family rules and discipline, when they avoid conversations. Communication is the key. Whenever there is a loss of communication, especially in a child who used to communicate well with the family members, there is a withdrawal from responsibilities, verbal or physical abuse of near ones, like sibling abuse, like that. When there is more violence, use of violence on siblings, unexplained change in appetite or unexplained sleep habits, frequent loss of money from home, coming late or unexplained stay outs, or confined to room alone with friends. Such things are the red flag signs we have to roll out at home. And at home and school, definitely. Now, whatever we say, academic performance is definitely an important marker here, because children, they are 80% of children going to school, they go to school with the intention of getting good marks. And whatever we say, how much ever we say, even പഠിക്കണം എന്നുള്ള ഒരു വിചാരമേ ഇല്ല. Thing is, studies is the main factor stressing these kids, the adolescents. So whenever there is a change in the study pattern, like whatever it be, like an 80%, a child who's coming with 80%, usually gets 80%, now his grades are falling to 60. Or even a child who used to be an average child, but still his grades are falling, or his interest in the extracurricular activities are coming down. That is definitely a red flag sign. This we have to explain to the parents. Avoiding sports, extracurricular, and defiance of authority figures, definitely. Now, symptoms and signs again, I've earlier told all the that is specific symptoms and signs. Most of the case, what happens is they are asymptomatic. We look for substance abuse when there is an accident or when there is a crime or whenever there is some psychiatric issues or when the child comes for evaluation of underlying disorders. Like I told you, whether if there is a conduct disorder or or oppositional defiant disorder, such things happen, then we check for this. Other than that, if there is acute toxicity, children come with acute toxicity or even withdrawal symptoms. That is how we get the symptoms and sign. Like that is how we come to evaluate usually. So symptoms I've again told you. Signs mainly look for our skin, mucosa, nails, and also tachycardia, unexplained tachycardia in a child who's otherwise normal. Just we can just have a question. That is all. Like there are questionnaires. mm, Sorry. Okay. There are questionnaires. There are two questionnaires for this. That is questionnaires for substance abuse. Like audit is the questionnaire for uh, alcohol abuse, like that. There is questionnaire, simple questions like have you ever been in a car with a person who used to smoke, or smoking is so rampant that even that question may get a yes from most of the kids. But have you been in a car or a vehicle with a person who used to take substances? Have you ever been told by any of your friends or any of your family members that this you are using us you have to stop this, or you have to concentrate more on other things? Have like we won't ask them to stop, because if we ask them to stop, they won't come back. Thing is, they'll be lost to follow up. This is again another thing, the major thing for while managing an adolescent. Why I'm telling this is, it is not because we are not caring about the children. It is never because of that. It is because once we start advising them, once we start telling our high moral grounds and all, what are you doing, you are wasting your life, don't you think it is so bad? What happens is they completely shut down. They completely shut down from our this thing. After that, whatever they hear is our pare doordarshan thing, bling, that's all. Whatever we tell other than that, they won't be hearing, and they'll be definitely lost to follow up. So while dealing with adolescents, always have open-ended questions. Ask open-ended questions. Never ask leading questions. Never advise. Never give any of our views, even though we may itch to say that this is not the way to live. But we have to control it. When we have to ask open-ended questions, we have to get it out from them. Only then can we help them. And management needs a multidisciplinary effort. Acute intoxication needs to be managed medically. Chronic abusers, again, positive reinforcement techniques should be there, because lots of relapses can occur. But studies have shown that first 3 months of rehabilitation, if they are consistent with it, then the number of relapses are less than those who relapse within the 3 months. I'm just giving a bird's eye view only, because going more through the each drug, how the drug acts, how what are the symptoms, how which is the dose, like that would be, I think it is beyond the scope of this discussion. So I'm just giving a bird's eye view. Now, protective factors, again, the most important thing, one take home message which I would like to have today, because it is self control, the art of saying no. I'll come to it in detail. Family relationships. We have to understand that whatever be the peer pressure, whatever we think that adolescents, they hear only the words of their friends, they go after only their friends. But the thing is, if a person has a strong family bondage with a strong family member, or even a responsible adult as a mentor outside the family, then definitely that is definitely a protective factor for that adolescent. That is, even if they will hear, even if they will fight with us, when if the bond is strong, then definitely they won't go astray. So always, my usually I used to tell the parents of the children who come to my clinic, like to my hospital. I used to tell them that whatever, you just don't bother about their friends. If you have a strong bond with your child, definitely your child will hear you. Definitely your child will obey you, even if the child doesn't hear you or child answers back right now. healthy academic and extracurricular activities, because there is high academic pressure during this adolescent period. So children are we know the NEET results have come like day before yesterday. 20 lakh kids have written for this medicine. 20 lakh kids, less than 1% of them are going to qualify. So there is a pressure on the kids to excel well. So what happens is, and children at this age, what happens is they are more reward seeking. They want to be applauded. They want to be, it satisfies their ego. It satisfies their pride. So whenever in children who are not that good academically, such children, they usually what happens is they seek rewards in extracurricular activities, which is a good thing, or even sports, which is again a good thing. Sports are extracurricular activities. But still, there are kids who are not that good. There are kids who are not good. Maybe 50% of kids who are not that good in academics, that good in sports, or that extra brilliant in any extracurricular activities. Such children, we need to, but even they are reward seeking. Everyone is reward seeking. So, what we can do is we can applaud the goodness in them. Whatever you do, because anybody can be kind, anybody can be helpful. This is what we have to impart, even as when parents come to us, because I know majority like here there are a lot of senior doctors, distinguished doctors here, distinguished family physicians who have treated generations of uh, families. So the people who come with people come to you for more than a medical advice. We can advise them that applaud the kindness, the goodness in your children. Then that becomes a protective factor. Like your child needn't be a Bharatanatyam expert. Your child needn't be a university sports champion. Your child, if your child is kind enough, if your child shares things enough, that is enough. You applaud that and you see the change in the child. Such children won't go into addiction. They may experiment. Again, I tell you, they may experiment, but they won't go into addiction. That is what the studies tell. Okay. So the next thing that again I told you that I'll come to in detail about the empowering to say no. Because if everything about this class is forgotten and if only this sticks in your mind, then I would consider this class as 100% success. How to empower a child, an adolescent, to say no. We have to tell them that to say no with a friendly smile. You needn't get angry. You needn't get, you needn't get emotional. You needn't even like use harsh words, or you needn't yell. Simply say no. And even say no to whatever, like, because in peer pressure this happens, where that is they are at a pressure to experiment things. Come on, just have this once only. What happens once there is no addiction? Come on, have it. Come on, just this glass, just this puff. No, not because no, yeah, this damages the lungs, blah blah blah. No, it won't damage. This is not alcohol. When you say that it damages the lungs, they'll come up with no, this is not nicotine. This is not nicotine. This is something which is extra. Mm, this is coming very natural thing. This is coming from there. You have a puff. You needn't explain. You tell the children who want this. You needn't explain. Simply say no. And if needed, if needed, you can postpone things. Like, I need to think it over. Okay, not today. Maybe I'll tell you when I think it over. So that you can come up with again, 3-4 times of thinking over, they will definitely lose interest. And even then there is pressure. Even then there is like, this is what happens usually. When the child says no, okay, once fine. Then especially for girls, whenever these things are offered by their, boyfriends, what happens is, no, you don't trust me. That's why. Do you think I will do anything bad to you? At that time, what we tell them as adolescent physician means as what we have to tell them is that we just tell the same thing again. As a person who cares about me, do you want me to do something which I am not comfortable? If that answer is again a yes, then it is time to walk away from that place and inform an adult. So you say no clearly, loudly, with a friendly smile, firm, serious. You needn't shout. You needn't get angry. You needn't be emotional. You needn't explain. Just say no and come back. This is what we have to tell, make our adolescents aware. So in this stage, I would like to have a mention about YODHAAV. I know almost all of you would have been knowing about this. YODHAAV is an app. That is, it is a project coming up, which was taken up by Kerala Police for to curb the drug menace, the substance abuse menace. There is this phone number 9995999 then 56. Okay, 666666. This number, anyone it can call up whatever if there is anything like an alcohol abuse or a drug abuse, anything unusual activity that you come across, we can just call them. Our identity will be protected. Kerala Police will be like on this case. They will be following it up. So that is YODHAAV. Now, I know that a role of doctors, again, we know, don't judge, because it is difficult not to judge, but still we have to be, if we want them to go to the right authority, if you want them to go into rehabilitation, don't judge, ask open-ended questions, give only scientific information. This is again another thing. Sometimes we get carried away telling other things, like even carried away telling things which, as an elderly person, like as a other than a doctor, other than a professional doctor, what like a family member will say. Sometimes we will say like, look, ninde amma endokka buddhimuttunu ingeneyonnum cheyan paadilla. No, such things again, it will be they will simply shut it off. Just say scientific things professionally, facts, based on facts. Just tell, these things will cause like that. Just tell them the facts and then advise them. Guide the children and parents to proper facilities and spread awareness. We can do a great way. At this onset, let me just, I would happily inform one thing, because Asha madam called me after seeing this, and Asha madam told that like we can, under the women's wing, we can do awareness classes for schools in Chinmaya. I mean, sorry, schools in Chinmaya just came automatically because I saw my son there. Schools in Kannur. Awareness classes can be conducted by the women's wing. Asha madam has told me, which is, I was very happy. So such activities, bringing awareness, because the doctor, the word of a doctor, especially very senior doctors who are considered as, near to God by the patients, definitely they will listen and heed to such things, such words. I know that there may be a lot of people who are cynics, idonnu nammale kondaavilla. I have heard a lot of people telling this, drug എന്ന് പറഞ്ഞാൽ എല്ലായിടത്തും ഉണ്ട്, ഇതൊന്നും നമ്മളെ കൊണ്ടാവില്ല. There I would like to tell you about a story. That is Kolavayal village. I know many of you must have heard about this. Kolavayal village of Kasaragod Panchayat, Kasaragod district. It is drug free. How they've made it drug free? There is an 8-point model. What they did is they launched extensive awareness campaigns everywhere. Extensive, all walks of the society, they launched awareness campaigns. After that, they took the support of the community. What happened was, definitely in such cases, the community will help us, because no one wants our kids to be drug addicts or even use substances. So community will help us. So there is dealing with drugs mafia with the support of community. They dealt with the drug mafia. 20 adolescent and 20 people were identified, and of this 20 abusers were identified. Of this, 12 people they supported, like they did support mechanisms, send them into rehabilitation. They were willing. And there were 8 people who are not willing, who are resistant. Like these were the peddlers, the traffickers, like the agents. They were curbed with the help of police. They were put behind the bars. And now each adolescent, each person is being watched, so that any risk factors are being taken, are being solved then and there. And the whole village is doing this together, so that their future is substance free. So such models, we can definitely make use of such models. If they can, definitely any village in Kannur can. So with this, I'll just, this is again another pledge for, pledge for the future. With this, I come to the end of the presentation. I'm sure we can do a big way into curbing the menace of substance abuse, especially among the next generation. Thank you all for the patient listening. Once again, thank you.
Thank you, Dr. Swetha, for the excellent and very informative talk. The topic is open for discussion.
Yes, sir.
These type of activities. Okay. Who's responsible for the peer pressure? It is the parents. Every parent wants their children to become a doctor or an engineer. After that, you said that if they know Kathakali or Bharatanatyam, they should go for that. How many of us have done that? Nobody. So we are responsible.
Dr. Your talk was excellent.
Thank you, sir.
And you might have read the news in today's paper that few DYFI volunteers caught one lady selling hams and pan parag and all those things. So I think this should come from the society. And another question, the YODHAAV. If I inform them about the drug peddlers, no, are you 100% sure next day I won't be stabbed by them?
Sir, what they tell us, like, it will be kept confidential. And YODHAAV has been launched for a lot of months. I think there is no such increased incidence of deaths. So most probably they are keeping it confidential. So children as young as 9-year-old is in rehabilitation. 9-year-old, 4th standard child. The problem is again, majority of children, they don't majority of children, they need this, this feeling of getting rewarded. So what happens is, even in extracurricular activities, there is a lot of competition now. Like കലോത്സവത്തിൽ ഫസ്റ്റ് തന്നെ വാങ്ങിക്കണം, സെക്കൻഡ് വാങ്ങിച്ച പ്രശ്നമാണ്, ആ ഒരു രീതിയിലാണ്. So what happens is such children are being targeted. So അവിടെ എത്തുമ്പോൾ there is a feel good thing. And everyone among for the time being, what happens is all those who use this, they are openly welcoming this child into their group. And this openness, this acceptance, this child is not getting anywhere, neither from her family, nor from her teachers, nor from the school or other things. So ഞാൻ ഒന്നിനും കൊള്ളാത്തതല്ല, എനിക്ക് ഒറ്റയടിക്ക് 5 സിഗരറ്റ് വലിക്കാനാവും എന്നൊക്കെ വിചാരിക്കുന്ന ആൾക്കാർ കുട്ടികളുണ്ട്. Like taking that as a very big achievement. Yes, sir. True, sir, very true.
I have a question. Why is it called substance? But everything, every matter is a substance. Why this particular psychoactive drugs are called substance?
That I don't know, sir.
Yes, sadhanam. That is the very essence. If I say that there is no substance in your talk, not about you, but then it means that there is nothing important in it. So substance is a matter which it occupies a space, it just got a physical and chemical property. Why is it called substance? സാധനം സാധനം എന്ന് പറയുന്നത് ചിലപ്പോൾ ഈ ഇതിനകത്ത് സ്മാർത്ഥ വിചാരത്തിൽ ആ പെണ്ണ് പറയുന്ന പേര് സാധനം എന്നാണ്. ഐ ഡോ നോ വെദർ യു നോ വാട്ട് ഈസ് സ്മാർത്ഥ വിചാരം.
അറിയാം സർ.
Mm.